Risk of taking aspirin, which can cause serious internal bleeding, now outweighs the benefits. Well, let's talk to Professor Stephen Field of the Royal College of GP. So let's be clear then, doctors are being urged now to stop prescribing aspirin to those people who haven't had a heart attack or stroke, and that's perhaps despite any medical genetic history.
Exactly right, you've described it perfectly. This is an independent review of a number of clinical trials. It's independent. Drugs and Therapeutics Bulletin have looked at all of the trials, and I think this is significant advice. It must be very confusing for patients, but what we would urge is patients who are either buying low-dose aspirin or being given it by the GP who haven't had a heart attack or a stroke to just make a routine appointment and go and talk to their GP about it.
And can you explain a little more clearly, perhaps, then, what are those potential risks?
Yes, well, there's no need to panic at all, but what they've done on a number of studies is looked at people over a number of years taking low-dose aspirin, either bought over the counter or prescribed in the absence of a history of heart attack or stroke. And the evidence is that it causes an increased number of gastric bleeds, stomach bleeds, which can kill people. And if you put that in an equation, the risk outweighs the benefit. The benefit is very small. But it is important that those people who've had strokes and heart attacks who are on aspirin don't stop it. That's the clear message.
Professor Field, thank you very much for joining us. Thank you.